Hi, welcome to Upbeat.
Glad you joined us again.
Today we want to talk about the difference between a heart attack and cardiac arrest. They're actually two different things. Most people think they're one and the same and use those terms interchangeably, but that's not really the case. So we want to explain the difference between the two. So first of all, we want to talk about a heart attack. A heart attack happens when you have one of your coronary arteries, which we talked about in our previous session. One of those gets blocked. They can usually, we get plaque buildup over time, but that's not really what causes the heart attack. It's when that plaque ruptures or bursts out of that little pocket it's in within the artery, and either that piece of plaque lodges in there and totally blocks off an artery, or a blood clot forms where that broke out of there. It's really rough and platelets start sticking to it and they form a blood clot and they cut off the circulation to anything below where that has formed.
So a good illustration of that is, I think everyone has probably at one point or another tied a rubber band or a string around your finger, and you can see how that finger turns purple. Let me try it on you, Mindy.
Really?
Yes, let's show you. Let's show everyone what we're talking about. Give me your finger here. So we're going to just cut off the blood flow to Mindy's finger here. And you can see immediately it's starting to turn red here. And if I never untie this rubber band, this finger will start to turn purple, and then it'll probably start to hurt. And eventually, if I never untie this rubber band, she would lose feeling in this finger, and eventually the tissue would die. And of course, a finger would probably shrivel up and it would probably fall off. So of course, I'm going to untie this for Mindy's finger.
Thank you.
But you know, of course, let's get the blood flow back. And of course, part of your heart isn't going to shrivel up and fall off, but you can do long-term damage if you don't get blood flow back to the part of the heart that's giving you those symptoms as soon as possible. So if you can take that rubber band off of the finger, you can save the tissue, right? So in a heart attack situation, Mindy mentioned that there's a piece of plaque or there's a blood clot that is formed where that plaque has ruptured, and it's now totally blocked off the blood flow down that artery, and part of your heart is going without blood flow, so it starts to hurt or maybe cause you to become short of breath, or all the symptoms that we've talked about in our signs and symptoms video. And so hopefully when you start experiencing those symptoms, you'll get to the emergency room as soon as possible, and they can get you to the cath lab very promptly and put in a stent or do an angioplasty to open up that artery and get blood flow back to that part of the heart. So, and that's the, symbolic of releasing the rubber band from Mindy's finger and getting the blood flow back, is that she maintains the function of that finger and the tissue stays alive.
Second, we want to talk about cardiac arrest. And so, again, it's totally different than a heart attack. Now, heart attacks can sometimes lead to a cardiac arrest, but when someone just has a cardiac arrest, they fall or collapse. It's a lot of times because of a rhythm, an arrhythmia in the heart. The electrical system is off, where coronary arteries are more the plumbing of our heart. The electrical system just malfunctions.
That's right. And, you hear about these athletes that collapse on the basketball court or collapse on the football field. That's a prime example of someone who didn't really have a heart attack, but they did experience cardiac arrest. So there's a couple of different reasons why you would have cardiac arrest, or a couple of different rhythms that would cause cardiac arrest. One of those is called ventricular fibrillation, and the other one is called ventricular tachycardia. At any rate, with both of those rhythms, you are not, your heart is not pumping enough blood out of it in order for your brain and the rest of your vital organs to continue functioning. So you go unconscious, and if you aren't able to get help from anywhere, primarily defibrillation from an electrical source like an AED, or if you're in the hospital, they would give you a shock from the defibrillator there, then it could result in death. So getting help as soon as possible is not only going to save your life, but again, it's going to save the quality of your life, because for every 10 minutes that someone is down without blood flow to their brain, for every 1 minute that you go without blood flow to your brain, your chances of survival decreases by 10%. So getting help immediately is imperative.
Correct. So Anyway, that is the difference between a heart attack and cardiac arrest. Hopefully that has given you some good information, and we hope that helps you to stay upbeat. Don't be a deadbeat.
Stay upbeat.
Thanks for watching.